What are the options available to Hong Kong for tackling doctor shortage?
How can we leverage on our existing healthcare workforce to improve manpower planning?
Hi, my name is Mika, and today I have Maira, my colleague, who has very kindly joined us to talk about doctor shortage.
Thank you for having me, Mika.
Thank you, Maira. I don't know if you've seen the news recently, but in the US there was an article about the doctor shortage problem, especially during the COVID-19 pandemic. And they have a shortage of doctors that is expected to rise to between 54 and 139,000 by the year 2033.
We have seen sort of the same similar situation in India's healthcare system. So actually, before coronavirus happened, India's healthcare system was already facing a serious shortage of 600,000 doctors and about 2 million shortage of nurses. And not just India or US, but even globally, according to WHO's latest report on global shortage, they found that 31 OECD countries would be facing a shortage of 1.2 million doctors.
So this is obviously a global issue, a global problem, and also in Hong Kong we are experiencing a doctor shortage issue as well.
You know what's really interesting to note, Mika, is that Hong Kong has done a really good job in terms of the COVID-19 response, but we also face a severe shortage of doctors. So do you have any sort of insight in terms of that?
Hong Kong's hospital authority, HA, actually created a pilot scheme, created 24 integrated nurse clinics inside public hospitals, gave nurses actually a lot more power to make decisions, clinical decisions, also advancing medical appointments based on a patient's changing condition, and that really helped with waiting times in Hong Kong.
So I think that's actually really great. When they increase the capacity, we can see that there are outcomes where we've seen a reduction in waiting times, especially in the midst of the whole COVID-19 pandemic.
So apart from what we just talked about with the nurses in Hong Kong, what other options are there that Hong Kong can consider?
One of the other options available to Hong Kong is to look into the system that accepts foreign trained doctors that are incoming through, say, the limited registration scheme or even the full registration scheme. And what we can do is sort of understand their perspectives and even understand the qualifications they have, and even look into whether we are effectively utilizing their qualifications in a way that is contributing to the problem of the severe shortage of doctors in Hong Kong.
Yeah, so I think with reforms we should really aim to obviously improve doctor shortage, manpower, healthcare workforce planning, and I think COVID-19 really is a window of opportunity that we shouldn't miss, and we should really make the most of this chance to really make a difference, change the system.
Guys, if you're interested to know more about the research that we do at the healthcare team, you can follow our social media.